Good evening. New COVID-19 cases are falling in some parts of the country, leading some health experts to predict that the pandemic may be starting to slow down.
But as KELOLAND's Tom Hansen shows us, Sanford doctors expect cases to continue to rise in South Dakota, especially on the west side of the state.
As of Tuesday, there were 44 COVID patients in Sanford's ICU. 32 of them were on ventilators. Dr. Mike Wilde says the Delta variant is spread easily, especially among those who are not vaccinated. And while other parts of the country may be talking about improvements, Wilde says our region typically plays catch-up.
In the upper Midwest, traditionally with infectious illnesses like influenza and RSV and things like that, we're kind of the last to get it, and we're kind of the last to have it leave. A little more isolated up here, but our turn does come, and we're certainly seeing some of that right now.
Wilde says the hospitals are preparing for a possible increase in patients with other illnesses, such as RSV and the flu, on top of those with severe COVID.
Really pushing that influenza vaccine, the COVID vaccine, but also looking at, do we have the staff, the people in place, and to continue to provide that great care, not only here in Sioux Falls, but as close to home as possible.
Wilde says one of the most inspiring things for him is seeing his staff rise to the occasion.
Staff is working incredibly hard. They're absolutely tired, but they're incredibly resilient. Healthcare really tends to attract a very special person.
Wilde says the old days of toughing it out and going to work when you are sick need to be over, not only for your health, but your friends and coworkers as well. Tom Hansen, KELOLAND News.
The CDC says South Dakota remains an area of high transmission of COVID-19. The state's vaccination rate continues to be slow. According to the CDC, of the state's entire population, nearly 60% of people have received at least one dose. Nearly 52% have completed their vaccinations. Sanford employees also only have a few more weeks left to meet a vaccine mandate. The COVID-19 vaccine will be required by November 1st.